of the minor outcomes of the pandemic, to be honest, is that people look at me a little less blankly when I say that I do public health. And when I started my medical specialty training in public health, I got the film Contagion out to make my family watch, to give them a bit of a taste of what I do. And I don't know if anyone here has seen the film Contagion. It's a brilliant film, a Hollywood blockbuster, probably at the moment, a bit more of a documentary. But we're watching this film and I'm pointing to the various characters to my parents and saying, oh, you know, I do this, and oh, that one's me and that one's me. And slowly, as we're watching the film, the characters slowly start to die. And my dad, nice to see you, Dad, turns to me and said, this doesn't bode very well for your career. And here we are in the midst of a pandemic. But public health is often really seen, it's around population health. It's not about the individuals. And it's typically seen through three pillars, really. And the first one is around health protection. So that's what people are so familiar now with: infectious diseases, but also chemical outbreaks. It's your radiation. So one of my consultants, she was involved in the Litvanenko case, in SARS, all the kind of big things that you see, preparation for the Olympics, Buncefield. The second arm is more around healthcare public health, which is how health systems work and how we can use them most effectively and efficiently. And the third one is around health improvement. And that's around supporting people to live healthy lives, whether that's around eating healthy, healthy weight, sugar tax, drug and alcohol, stop smoking. But my particular area is around child and maternal public health. And I've been doing that from a range of national and local organisations. So nationally, working at the Department of Health, at PHE, at NHS England. I had the opportunity to work with another suburb member, so with Claire Lima, under her on the Chief Medical Officer's annual report, previous Chief Medical's annual report around children and young people. And most recently, so exactly as you say, working at Camden and Islington Public Health Team. And I led on their children, young people, maternal programme of work, and led on their outbreak response for children whilst I was there. So how did I respond to the latest pandemic? And again, everybody has their story and perspective. And I know that we've got a lot of health and medical educators on the call now as well. For me, it really started early on, back in January. I was on one of my on-calls, and I'm one of those people who's quite unlucky during their on-calls. If there is a strange, weird and wonderful spider infestation in a nursery, if there's a traveller coming back from abroad with some strange medical disease, something that's likely to be in the newspapers the following week, that will be on my shift. And so it wasn't so much of a surprise to have something, this Wuhan disease, as the call operator called it, and said, oh, is that Wuhan? Am I saying it right? And within a week, it was in all the national papers. Within a few weeks, my on-calls were all-night contact tracing. And back at Camden and Islington Public Health Team, we moved from prioritising work to COVID work to sit down with all of us to stop whatever you're doing and focus mainly on COVID and COVID work. And it was also near the beginning there as well. And again, educators on the phone will remember when we started just before lockdown, where schools were finding it very difficult to carry on as they were. Staff were being sent home just for having symptoms, or anyone in their home having symptoms, and doing a call with 100 very, very angry head teachers alongside my education and other council colleagues, all of us sharing those headphones, which obviously we shouldn't have been doing anyway, and informing them and working with them as we moved just before lockdown as well. So for me, that was really how it all started.
How did you develop the relationship with head teachers? Did they begin to trust that you could give them information they needed, or they were just so flustered by the things the governments were throwing at them? Or how did you how were you able to support them?
So I think with the head teachers, I mean, they've done an amazing job moving from trying to keep as many children in school as possible to contact tracing. Now they're going to be testing centres. They've really.
Yeah, I'm not sure they're so qualified to
So,
to do that.
So that was whatever could be done to support them was what we worked to do. And again, it was a real partnership working with, as I said, colleagues within the council, speaking directly with the head teachers. They all have my phone number, working with them on webinars, resources for their schools, supporting them through as I said, weekly talks with them, letters for their staff, a kind of scenario workshops. I think one of the things that really surprised me, they wanted a lot in terms of wanting to know a lot of the kind of medical nuances and the background, and having to teach a whole load of medical educators, professionals is not a highlight of anyone's week. But it was working really closely with them throughout the pandemic as much as possible. And now in my regional role, being able to support more widely colleagues within the councils to do some of that work and resources as well.
Okay. And also when we talked in preparation for this, you talked a lot about the issue with the vulnerable young people and children and the issues you had to deal with in terms of that. So do you want to talk a little bit about that?
Yeah, I think that was when the pandemic started, again, there was a real emphasis on elderly people, as there should be. And in the beginning, it was an understanding that this wasn't about children. Children seemed to not be affected. They were not catching the disease in the way expected. They didn't seem to be the super spreaders thought to be, and they weren't in hospital that much. And the management of where we would have been very different had it been something that affected children. But at the same time, there was a real in the beginning, there was a real issue with children not going to hospital when they should have been going to hospital. So not going to hospital departments, and children were dying terribly or having long-term morbidity based on not seeking the care that they needed. So that was a kind of early role in supporting with the nuances around the information that we would give them.
So how did you change the messaging to make them realize that you need to do this?
Yeah, so again, that was a lot of working with partners across health and social care, education settings, sharing messages, posters, things in local newspapers, using our media partners to really emphasize the message that, yes, stay at home is important, but if you have a medical condition or something that needs seeking attention, whether you are a vulnerable young person, pregnant women as well, if their baby's not moving, hospital is still the place for you and where you need to be.
And so did your team, because you said, when you began, very quickly you were all focused on COVID issues, but then not necessarily this one. So when you realized this, was there like a concerted effort to organize this and to make it happen, or it's individual? Like, how systemized was this?
And I think that was, you can look back and reflect what's happened over the last 10 months. And in April, when everything went into that end of March, into that quick lockdown, and again, everybody would have seen that in their respective places of work. Very quickly, within a couple of weeks, partners in health and social care, in health services and education, very quickly galvanized everything, regrouped, restructured, and pull things together. We had networks moving onto digital platforms, and we were able to very quickly. So communication was a key part. So communicating with families themselves, communicating with our partners on what we were doing, and bringing those networks together, and also helping them from the kind of public health point of view in supporting their settings in the best way that they could. And other key areas that really emerged during that time for children was around safeguarding, for example, the safety of children in their home. We know that domestic violence rates, for example,
Right,
went
of course.
Around mental health for children and their families, around poverty. And people talk about the government choosing between lives or wealth. And Raphael, we discussed this as well, how closely entwined the two are and how important that is. And finally, the importance of education and the inequalities that brings where some children are getting the best education even during lockdown, and other children are missing out. And again, that safeguarding element of not seeing children in school, not being able to safeguard across that. So it was a real partnership working between public health, but also, as I said, health partners, council partners, voluntary sector, all working together.
And you told me a really quite a moving story, actually, about how, normally how long things take and how you were able to kind of come up with an idea and then lead to actually delivering it very soon. So do you want to explain that as well? Because that was I told my family over Shabbos that. So
I think it was that recognition of those very vulnerable people during this really difficult time. And I was sitting in the garden. It was a gorgeous bank holiday weekend, and the kids were in the garden running. We've got a lovely garden, running around with a hose pipe and everything else, and thinking that we had a lot of children and young people within our borough who lived in flats. They had no outdoor spaces, often multi-generational families living together. And with that as well, the lockdown at that time, parks were closed. You couldn't even stop for a picnic. So I went into work the next week, and within a week, between partners of social care, parks and open spaces, with commissioning teams, would set up a scheme which we called Garden Spaces for All, which was offering families 1 hour window slots when they needed it to go outside, have a picnic, sit down. I mean, we had to think of everything for it. There was even a bit of an Morris Iron element, if you like, that we couldn't use just any park place. It had to be something that other people wouldn't see them. But we evaluated the program afterwards, and people talked about how life-changing that program had been. So that was a real highlight piece of work. And that there were other work that we did with vulnerable children. Again, recognition that people were kind of stuck inside confined spaces. We sent packs out to families to help them exercise, little gifts for families that needed. And again, really, really lovely feedback from those families that needed it.
Yeah. No, look, the first chapter of Isaiah talks about, the fundamental measure of the quality of a society is how do you treat the most vulnerable, the orphan and the widow and the poor, and how he acts. It's great to hear those kind of stories. And were those then passed on to other areas? So York, Camden, Islington, was there a constant writing up and sharing between other boroughs or other places in the country what was going on? Like, how are you getting information about what everybody else was doing?
So again, it was an opportunity for sharing across networks. So we had a network of consultants who were leading on children and young people, where there was a lot of sharing of ideas. And I think that's one of the nice things about being in my job now, which is more regional. It is a more regional perspective. Everybody is so busy dealing with the immediate effects of what's happening. Hopefully being able to give support to establish some of those networks and share some of that really amazing learning that is going on throughout the country.
And what, if I can ask, if it's not fair, then tell me, but is there anything that really surprised you or really shocked you or unexpected in these 18 months of like, that it really shook you, or something that wasn't what you thought? I mean, the kind of people that do your job are kind of calm people who know what they're doing. That's the whole point. But there must be some times where you're like, this is too much, or this, I didn't expect this to happen.
I think there was a lot. I think people, and again, everyone, you would have all seen that in the various places that everybody's been working for the last 18 months, the last 10 months, is how everything's turned upside down. And I think the amount of hours that people were putting in, and I've already talked about how quickly things happen, but the connectivity between people. I'll bring out a couple of examples, if that's okay. I think the first one is my technology issue. We just had our work Christmas party, and it was a competition. What is the top expression from 2020? And it was "you're on mute." So we've been able to see the digital aspect to bring people together. I've had my own BBC moments where children walking through the door, and I've seen pets, grandchildren, people coming out of the shower, but also the amazing way of bringing people together, like we have now. So the sharing of learning. But we did, after doing a lot of webinars for head teachers, for families, for all kinds of things, we wanted to do a bit more work with communities to let them have the opportunity to ask the questions that they wanted. And we did we did a webinar for families. We had the head of children's service, we had the nurses, we had Johnny Cohen, my fabulous brother-in-law, who was talking from an infectious disease pediatric perspective. And we had, everyone was there on the panel to enable people to ask their questions. We had one in Islington. It went beautifully. It went really well. We had the questions people wanted. And then we repeated it in Camden, and the chat was open. And that was a real lesson for me in engaging with the public through social media. And watching the chat unfold as the discussion went on. And I think it kind of came to a climax when I very innocently said towards the end, and don't forget to have your flu vaccine, and really seeing the massive anxiety that families were having about returning to school in September. And I think, you asked about the relationship with head teachers. By September, I think we'd had a lot of those conversations with the head teachers. We'd been on the journey with them. We'd seen that. And it was back in September, seeing really the anxiety that families had, that made us think, right, what more can we do to work with the families, give them the messages that they need, and how to do that. And we repeated the webinar. We did it 6 weeks later without an open chat, and it was a much calmer experience, and allowed us to answer a lot of the questions that people wanted to have.
Right. Well, thank you. We're going to open it up to questions in a minute. So if people have questions they want to write in the chat, that's a good idea. One more big question. We've all just found out, not only are we moving into tier 4, but schools, except for 2 years, will start a week later, and all the schools are being turned into test centres, which honestly sounds completely mad. From my point of view, like, schools are not trained to do that necessarily. First of all, when did you find out about this? and how is it, you're working regionally now? Is this part of your remit to deal with schools, to deal with this issue?
Yeah, I think it's interesting things. There's constant changing. I think reading Chris Whitty's comment this evening, where somebody had asked him, I'm sure you've all seen this, but is this the worst it's going to be? Is this the worst we've been in? And he answers and said, oh, it's all been terrible. So I don't know if it'll something like that. There's been so many terrible moments. I think we won't know how well we perform for a few years when we look back. And I think people are looking at different countries throughout and the lessons that can be learned. Sweden is one that we're looking at in particular. There are updates, there are changes all the time. I think we need to react and respond when we learn more about the virus, new variants of the virus. It is looking at the data we have, at what we have accessible to us as well. So I think it is right that there is a changing and a response, and it's about working closely with everybody, with all the partners that we have at regional, at local or national level, wherever we are, and seeing when the guidance comes up how we can best support those partners that we have as well.
Yes. No, I know, because I've got people on there who want to ask things like, I know you can't answer this, is the government doing the best they can, or are they failing abysmally? Obviously, as a government worker, you're not going to answer and deal in that way. What I'm asking is, and what you told me on the phone, and it was very, and I'll tell the people there, your reaction is very much, this is what I've been given. How can I make the most of it? Which is much more effective sometimes than just, complaining. I understand. Have you had, since the only information was very recently, have you had, though, all the head teachers on the phones already about what's going on in this and in terms of their schools, or are they kind of buckling down and realizing that they have to do this, or what?
So it's quite different in my regional role. I think when I was working at Camden Islington, I was much more close with the teachers, with the council, school partners, and with our partners working on that. And it was working really, really closely. I mean, it was a real amazing lesson for me on how well we could all work together, and these regular webinars with updates and talking to everyone and really keeping very close to the head teachers. It is slightly different from a region, but again, it is that network working as things come in, working together on how we can best move forward as well.
Yeah, no, very difficult times coming. I mean, I know in Birmingham, when they had the schools, they had these lockdowns, they had the army coming in each place to help with the testing. So I presume you're going to get lots of soldiers turning up in all the Jewish schools as well. No, because I was talking to heads of JFS and so on. They're quite conscious because they've just started a CCF, so it's going to be kind of soldiers in the school. It'll be quite interesting. Do we have questions from, let me just open it up to everybody else. If there's questions you want to ask, feel free to write it in the chat, maybe. That might be
I
the
can't
best.
see the chat because I'm afraid I'm on
Yeah, no, I can. So Michael Teacher's asking, after the pandemic, what have you learnt that you will continue to implement?
What do you
Oh, that's a shocking question because you disappeared.
Hi. No, what I wanted, hi, can you hear me?
Yes.
Yeah, hi. Hi, Leonora. I'm Sandra. We've been emailing each other. It's good to meet you. Is she there?
I think Leonora disappeared. That's the problem.
What I wanted to ask her I've been part of the Ofsted research team, and we've produced a paper on the effects of pandemic on education. So my favorite question that I have to ask is that after the pandemic is over, will you be keeping any of the changes that you've put in place? What good things, what positive things has it produced that we wouldn't have possibly thought about before that you're going to be keeping?
Leonora, you're just back, right?
I am back, so I'm afraid, apologies, I missed
No.
the question.
So Sandra, do you want to ask just one more time?
I'm Sandra Teacher. We've been emailing each other. It's lovely to meet with you.
Really nice to meet you.
So I've been doing this research with Ofsted. I'm a school inspector, and to see the effect of the pandemic on educational settings. And I said my favourite question to them, or an important question, is, because I'm trying to always be positive, what have you implemented during the pandemic that you'll be keeping after everything's open? What's been fantastic that's innovative because of the pandemic that you'll think, oh, when all this is over, we're still going to continue to do that, which we wouldn't have thought of before?
I think there's a few things. It's a really, really lovely question. I think the first thing was what I was talking about, the speed that things can happen. I think it's a real lesson for how quickly we can just move things forward and make them happen. I think the second thing for me, again, is that digital aspect and how, for months people are talking about before the pandemic, oh, it's too hard from work from home, or we can't bring everyone together, and how in many ways, how successful that has been as well. And I think that the third thing, if I can bring out a little bit more, standing back, is something that I discussed, Raphael, with you earlier as well, is what it means to be a community. And I think this has been such a time of such distancing. And Edward and Bubbles, you reminded me at the beginning of our conversation, when Central Square Minion, right near the beginning, didn't have
Oh.
You're frozen.
So do you want to guess what she's going to say now?
moving and spiritual time, actually, to feel the community.
Oh, you keep freezing, Leonora. We're very worried about you. We'll try and see if it works out. I don't know, it must be
low battery.
No, I think it could be Wi-Fi stuff. Wi-Fi is very consistent everywhere at the moment, so we've lost Leonora. Hopefully she'll come back. The point she made about NHS appointments, Leonora, right, we found you again. Excellent.
I'm here, sorry. Back. So yeah, so just walking through Rosh Hashanah, Yom Kippur, through Golders Green and Hendon, and seeing those marquees and those garden shuls, and how that was supported through the national guidance, actually, and having national guidance which picked up everything from a sukkah crawl to those garden minyanim.
I wanted to see if other people have got questions. I don't want to sort of pocket.
Hopefully Leonora will make it back to us. I was just mentioning that a lot of doctors are now doing appointments online, much more, and it kick-started this drive the NHS has wanted for a long time. But Leonora, I think you're back with us. Can we hear you?
Yes.
Right, so I wanted to mention, there's a question from Evelyn Stearns, a great question comparing to America. In the USA, she's saying, or You've gone slow again. Maybe you can hear me. I don't know. I'll read it anyway. In the USA, there are significant demographics that at present do not want to take the vaccine. Far right, the black community, there's a lot of mistrust of the government. Do you see the same issue happening in the UK of people not en masse or certain groups not wanting to take the vaccine?
Apologies. Could you put that again? Because I cut out.
That's absolutely fine. In the US, there's large demographic groups of people, right, minorities and so on, who are very nervous about taking their vaccine or don't want to. Do you think that's going to be a big issue in the UK? Or do you think the mistrust of government's the same, or do you have any statistics about that or information?
So I think that's what we had a really, really interesting talk from someone within Public Health England this week about the vaccination. And she was talking about anti-vaxxers and saying, actually, the word anti-vaxxer it's not a very nice word. And a lot of people who are traditionally called that, but they're not anti-vaxxers. And actually, it's human nature to be suspicious. And we need to inform and explain to people about vaccinations or anything else in terms of medication that we give them. So I think that will be a huge part of the next phase, is around that communication. I think the vaccine in itself is quite amazing, that within such a short time of the disease to have a vaccine, talking about in excess of kind of 253 different candidates and 50 of them being used in vaccine trials. And but I think it's important that we don't just assume people are just going to come, that we need to make sure that we give them the information that they need. I know that the British Society of Immunology has got some amazing work on their website, so I would recommend having a look at that, and understanding how the vaccine works and the effect. But ultimately,
is the vaccine effective on the new strain, on the new variant that's just been coming out now?
So I'll be honest. So I'm sure there's other experts on the line as well who know more. But I think the vaccine in itself, the program has started. There's a second vaccine that's just been licensed. So with Chris Whitty saying this is another terrible moment, I think and we've seen already tonight Boris Johnson saying that we're hoping by Easter a lot of people would have been vaccinated, and it will allow us to move forward. Well,
look, one more thing on the new variant. Someone's asking, they're saying, that it's much more contagious, the new variant, than previous. Has that changed the policy and how you're acting in terms of advice to people?
So I think that the key, another key pillar of public health is around the evidence and the data. And I think it's early. We still need to understand more around this new variant, what it looks like. And as information comes in, we should and we must react to it in the most appropriate way that we can.
And one more question as well I've got here is it's a particular one from Joe. I was rejected at the Royal. Oh, jumped up and down. Sorry, I was rejected at the Royal Free last week for the vaccine. I had an allergic response to carboplatin and to some nuts, but it had to be life-threatening. But I would prefer to be vaccinated. I wonder if the next vaccine will be okay. She's asking.
So I think that's with vaccines that come through, whenever a new medication comes through, and again, health partners on the phone will be very familiar with this. There's a kind of yellow card reporting system where things are reported, and it doesn't necessarily mean it's caused by it, but you have to examine each of them very, very carefully. And there have been 2 health workers early on with the vaccine that reacted with an allergic reaction, and that needs to be carefully investigated. So that's so for the moment, that would be contraindication to the vaccine is a previous reaction, allergic reaction, not just to medication but to food at the moment. But again, it's looking at the data, understanding, finding out if it was how it was related to the vaccine. And the new vaccine, I don't know enough yet whether that would cause
exactly, yeah. And there's other questions here asking things obviously you can't answer, which is, was the government too slow? If we're supposed to be learning from other places, Sweden, and why didn't we learn from America about Thanksgiving and about opening up, and why did it take till tonight to close down? But obviously, it's not for you to comment on. But do you welcome the announcement tonight? If I can turn it to positive.
Yeah, I think, and as I said, there will be a lot of reflections on the other side of this, and looking at how countries have reacted, how it's done. I think with the advice around the vaccination, it is a whole nuance of not just the behavior that we have to do, and you've got your kind of face space messages that are going out, but also thinking about the behavior of people, and so working very closely with behavior insight teams, for example, on how people behave and people's lethargy and how they react to things. So it is a very difficult balancing between the messages that you have to keep people safe, and also recognizing the impact on the economy, and the impact on the economy influencing through the lines on the health of everyone long term as well. So it is that very, very difficult, nuanced information, and it is about we've got the sage scientists. It's looking at the data, it's learning from other lessons, and it's bringing it together to see to strike that balance very, very carefully. And it isn't easy. It's not easy.
No, thank you. Well, look, Leonora, I really appreciate you talking to us. The issue about behavior insights and how people respond to these situations and how you need to handle that is fundamental. And with people like you who are being calm and sensible and answering as well as they can and being supportive, and instead of moaning to the government when they're given things, but saying, well, this is what I've got, what am I going to do? And then from what you've told me, staying up a lot of the night, many nights doing it, I certainly, and I'm sure everybody else is very appreciative of what you've been doing. And we need to keep our heads, because the vaccine is being taken. They've had 300,000 already. They hope to get by March a good 20 million or so, if you work it out, and that's quite conservative in some of the rate. So it's really quite exciting. So thank you very much. Do you have a final message or advice you want to give us in your role, or as a CSM member, or as a Motzei Shabbos Jew?
Again, it's reflecting from that Jewish perspective again. And I think there's been something about that pandemic, about seeing when lockdown happened and time dissipates, having that 7-day cycle and the importance of that. It's about being able to turn off the laptop and those computers for 25 hours every Shabbat. And again, I think it's that really key sense of community that we have during these strange and difficult times, and knowing that we are coming to the next phase. The weather is getting better. We know it makes social distancing and behaviors easier. We've got the next phase in terms of understanding more about the disease than we did in March. And as the vaccination comes through, being that a change to allow an endpoint for this as well. So right. I think it's difficult times, but moving towards optimism as well.
Oh. Well, thank you very much. Everyone's writing here. Thank you so much, Leonora, for your talk. Thank you, everyone saying great interview, all that kind of stuff. Thanks very much for you for doing that. And let's pass on to Edward for a farewell and end to the evening. I'll pass on to you, Edward. Thank you.
Nothing to add other than thanks and admiration. Clearly you use the word balancing, and that's the issue. You're balancing all kinds. You and all the people that you're working with, and there are huge teams of people working on this, are working terribly hard to balance competing positives and competing negative issues. And hatzlacha to you and your efforts, and chazak v'emet.
Thank you. Thanks everybody. Much appreciated. Be well, everybody, and see you next week.